All right, guys, let's get busy talking about trauma disorders. We're going to start off by talking about our adjustment disorder, which is going to be derangement in our emotional response or increased emotional lability in response to a life stressor. And examples of these life stressors could be things like breaking up with a boyfriend or a girlfriend, losing a loved one, or perhaps being fired from your job. This is going to be characterized by distress, sadness, and outbursts. These are examples of the emotional derangement or the emotional lability that these patients experience. These symptoms begin within 3 months of the stressor, but subside before 6 months. And it's really important that we acknowledge this timeline because psychiatry is all about timeline on step one. So here on this dotted line, we see symptoms start. So symptoms are going to start before day 90, but they are going to subside sometime before 6 months. And that's really important for the timeline of adjustment disorder. Let's also talk about our treatment. So our first line therapy is going to be cognitive behavioral therapy. If this is not sufficient, we can always step up to antidepressants or anxiolytics, depending on the patient profile and what is mentioned in the question stem. But pharmacological therapy, always going to be second line. Let's move on to talk about post-traumatic stress disorder, also known as PTSD. And this is going to be characterized by emotional response to life-threatening or intense trauma. So previously, the examples of stressors I mentioned in adjustment disorder were things like breaking up with a boyfriend or losing your job or losing a loved one. In terms of PTSD, the stressors are going to be another level of elevated up. So we're thinking like sexual, physical, or emotional abuse. Examples of this might be warfare, car accidents that are extremely life threatening, abandonment, and assault. So these are higher level traumas that are going to result in a higher level of pathology. This is going to be characterized by things like hyperarousal or a heightened startle reflex. And this is going to oftentimes be presented to you in a step one question as a patient who's sitting in the doctor's office and maybe a nurse comes in, and as she comes in to take vital signs, she slams the door extra loud and the patient jumps off the bed and is really, really distressed all of a sudden. This is what is characterizing the heightened startle reflex. Now, we can also see things like avoiding of associated stimuli. So if someone was really, really affected by a car crash that was life threatening, they may avoid any type of traffic or cars at all costs because this is going to bring back terrible memories of when they had their life threatened by a car accident. Also, they're going to experience re-experiencing of the event. This usually comes in the form of night terrors or bad dreams, where they will relive the experience. Certain stimuli may also re-bring them to like a daydream of their experience. So if this person almost died in a car crash, if they're at a busy intersection and they hear honking and revving of engines, it may bring them back and re-experience that terrible trauma where they almost died. Additionally, at baseline, these patients are going to have symptoms like distressed mood, negative mood, depression, and oftentimes they use substances in an attempt to kind of hide or avoid some of these really hard emotions that they experience on a day-to-day basis. Now, in terms of our important timeline, we have symptoms that are going to last greater than 1 month after the event. And that's a really key timeline here. So here I'm going to highlight day 30 is really important for PTSD symptoms. In terms of our management, we're going to first line use things like cognitive behavioral therapy and EMDR, which stands for eye movement desensitization and reprocessing therapy. And we can also use pharmacologic agents as well, like SSRIs, venlafaxine, and really high yield prazosin for night terrors. Remember, prazosin is going to be an alpha 1 antagonist. They may ask you about that mechanism of action on step one in relation to PTSD and night terrors. Now, let's move on to talk about acute stress disorder, which is going to have a really similar symptom profile to adjustment disorder or PTSD. However, it's important to note the timeline here. Timeline, timeline, timeline. So this happens between 3 days and 1 month, and then symptoms should stop. Now, important on test day, they will ask you about CBT because if someone has a minor or major stressor, starting CBT as soon as possible is going to be really important for preventing their illness from progressing to adjustment disorder or post-traumatic stress disorder. They love to ask about this, so I really wanted to mention it. So let's review timeline here. Acute stress disorder you'll see is only up to day 30, whereas PTSD starts to take in effect after month one. So knowing these timelines is going to be super important for forming a differential and knocking off distractor answer choices on test day. So let's just review some important things and wrap up our differentials. In adjustment disorder, this is going to be sadness, distress, and outbursts to a minor stressor like a breakup or losing a job. We're going to start out with CBT, and it's important to mention the timeline here. So begins within 3 months, subsides within 6 months. Now, in terms of PTSD, we're thinking really intense traumas here. So sexual, physical, or emotional abuse level type stuff. We're always going to be looking for that heightened startle reflex as well as potential substance abuse. Also, look out for prazosin use to avoid night terrors. I would say those are all really high yield things for PTSD in terms of symptoms and cause. And then, of course, we need to have our timeline down pat. So, symptoms lasting greater than 1 month from the initial intense stressor. Lastly, we'll round out with 3 days to 1 month describing acute stress disorder and the importance of early CBT to avoid progression to other pathologies.